By now, you have heard about the CDC's sweeping changes to vaccination recommendations for children. In this week's HealthLink, King 5's Christine Pei takes a closer look at how Washington state is responding and what local doctors advise.
We're talking about the well-being of children here.
Right, the most vulnerable section of our community.
Dr. Francis Bell is a pediatric infectious diseases physician at Providence Swedish in Seattle.
It just seems that this is a retrograde step. We're going back in time.
Here's what changed. As instructed by the Department of Health and Human Services, the CDC reduced the number of universally recommended childhood vaccines for 17 to 18 diseases down to 11. The new guidance downgrades several vaccines to lower priority tiers, including vaccines for COVID-19 and RSV.
Some of the vaccines that have been chosen are vaccines that protect against diseases that are almost inevitable in early childhood. So RSV, in the era before we had rotavirus vaccines.
And doctors say the timing of the changes could not be worse.
Is shocking, especially since we had the worst flu season in several decades last year and the highest number of pediatric flu deaths that we've seen in, I think, 20 years.
Dr. Helen Chu, professor of medicine and epidemiology at UW Medicine and former member of the CDC's Vaccine Advisory Committee, says the timing is particularly concerning. Just as the flu season intensifies, the CDC announced this week it is no longer universally recommending the flu shot for children.
So what you do when you make these changes is that it creates a lot of uncertainty and chaos, and it makes it very difficult for pediatricians and for parents to make decisions about what vaccines to give to their children.
The CDC, under the directive from HHS Secretary Robert F. Kennedy Jr. and President Trump, said the new guidelines match the recommendations laid out in other developed countries like Denmark. But Dr. Chu says that comparison ignores key differences in healthcare systems and population diversity here in the U.S.
The argument is that the United States has too many vaccines for children compared to many other countries of the world, which is, first of all, simply not true. And the reason why we have so many vaccines is because each vaccine was separately, carefully evaluated and decided to be safe and to be beneficial in the United States population.
HHS maintains, despite the changes, all vaccines currently recommended by the CDC will remain covered by insurance and families will not lose access, emphasizing individualized decisions based on risk. Why not give families a choice?
Families already have a choice. There is already a discussion with parents about the risks and benefits of vaccines. It's part of standard procedure for pediatricians to have those talks before vaccines are given.
The concern among doctors is whether the changes will add to confusion to an already complicated vaccine schedule. Dr. Bell says they're here for you.
Come give us your questions and let's have a discussion about what's right for you and right for your child.
As for how the federal guidelines will play out in Washington, states can still make their own recommendations, particularly for school immunization requirements, and insurance will continue to cover the vaccines. The Washington Department of Public Health stated it will continue to align recommendations with the American Academy of Pediatrics, separate from the CDC changes. For HealthLink, I'm Christine Pei, reporting in Seattle.